There's a new top dog around Stormont Vale's pediatrics unit. And no bones about it, this is one dose of medicine young patients like Isaac are happy to take.
You can hardly bring a dog into any environment without people getting a smile on their face, so I think it boosts the children's spirits.
While they regularly made rounds at the cancer center, Maggie is the first four-legged visitor under a new pet therapy program for Stormont's pediatric unit.
Maggie just loves people.
Her handler, Betty Rose, is part of the Prairie Land Visiting Animal Association, and Maggie is certified through the National Pet Partners Group, which makes her more than just a canine cutie.
They do some real life situations around walkers or wheelchairs and equipment so that they're not afraid of it. You know, revolving doors, elevators, not every dog, experiences that in their daily routine.
Maggie gets a fresh bath, ear cleaning, teeth brushed, and paws cleaned before every visit. The rest seems to just come naturally, whether it's quieter time with Karis, who's undergoing cancer treatment, or getting giggles from Isaac before he has surgery on his foot.
The children are so excited to see the dog that you kind of forget that they're sick.
Studies show therapy animals have a calming effect, and it's not just felt by patients.
It's a very hard environment to work in at times, pediatrics. We can get a little bit down, we need a little bit of a boost, and Maggie's helping bring that to us.
A prescription on paws.
The language of the dog is universal.
That's easy to swallow. The cheer from Silver Lake Elementary School students supports second grader Lily Shuckman and the challenge, as she's explained to her friends,
that my pancreas doesn't work, so I have to have this little thing, and it's called a pump.
Lily was diagnosed with type 1 diabetes just over a year ago when she was 6 years old. Her mom, Tanya, says they suspected a problem when one day she kept screaming for a drink of water.
I just kept thinking, why is she acting like this?
Her dad recognized the symptom from a cousin's child who had type 1 diabetes. Days later, the diagnosis was confirmed in Lily.
Our fears were that, she did have it, and how would we cope with this, and who would help us with it? What would it be like for her being so young?
The life is a little different.
Dr. Katerina Gambasova with Cotton O'Neill in Topeka is Lily's pediatric endocrinologist. Like Lily described, in type 1 diabetes, the pancreas doesn't make insulin to keep blood sugar levels normal. Patients take insulin to compensate, but how much is needed is affected by what they eat and their activity level. Think about that in a 7-year-old.
You give them a meal and there's 30 grams of carbs on the tray, but then they decide not to eat half of it. Especially in little children, it's very tricky.
Monitoring is key.
I have to prick my finger a lot.
Blood sugar levels are checked several times a day.
This monitors my blood sugar.
Lily now uses a device that continuously monitors her levels and a pump that can deliver tiny amounts of insulin throughout the day. Like other people with type 1 diabetes, she's not restricted in her activities.
Well, they can do just about anything they want to do. Any kind of sport, but it's just important to take the insulin and be monitored.
Part of the key in Lily sticking to these lessons are the lessons she's taught her classmates. The school nurse and Lily's mom explain what diabetes is and signs Lily might be having trouble.
We don't want them to be afraid of her. We want them to help her.
Parents have also received notes, not restricting snacks, but explaining why it's important Lily knows the carbs they contained.
You can send cupcakes, you can send stuff. But like everybody, you want your kids to be healthy. You want good snacks for everybody, not just a diabetic.
Her classmates have learned right along with Lily, even getting special shirts and buttons to support her team for a recent diabetes awareness walk, a sure sign they'll continue to be there for her every step of the way.
We can hope for a cure. I can't promise a cure, but I can promise that I will teach the community and her friends and our family to take care of her.
Santa Fe Trail counselor and volleyball coach Joy Schmidt believes in her players.
Go, be ready.
And they believe their coach will knock down the opponent life put in her path.
The reality of it, sometimes I still can't believe it.
Breast cancer.
Part of me knew that there was probably a change and that I probably should have done something sooner.
Since her diagnosis in March, Joy had her breasts removed, a mastectomy. She underwent chemo and continues radiation, and she's grateful her surgeon at the Stormontville Cancer Center began her journey by looking toward how it would end.
Dr. Sachs was my general surgeon, and he immediately said, okay, I think we need to get you with a plastic surgeon so that you can get a consult.
But studies show as many as 70% of breast cancer patients aren't informed of their options when it comes to breast reconstruction.
Women deserve to have all the options laid out for them.
Plastic surgeon Dr. Jack Peterson says timing becomes important in the reconstruction process. If women make a decision early, they may be able to save a step and move forward, not just with rebuilding their bodies.
There's obviously a huge psychological component if you've had a mastectomy. It's a body-changing event, and so there's certainly nothing that's a cosmetic procedure at all. It's basically recreating the patient's body and their self-image.
Those shoulders squared around.
Joy says she didn't hesitate to have her mastectomy, and she's not hesitating to move forward with reconstruction.
I think it just makes you feel complete, feel whole again.
She's attacking cancer with openness and honesty, especially with her team, who often trade their Charger red and blue for pink.
And it's probably helped me get through it.
Cancer, they say, won't steal their joy, and Coach Joy hopes she can serve up a little in return.
I want to be a good role model for them. You can persevere through most things. The whole ordeal has just made me be a better person, and I want to pay it forward.